I think, ma'am, Vaishali ma'am, can we go to the last speaker and then
sure, please.
All others, ma'am? I think the lineup is amazing. We had one person telling about the molecular level and the neuropsychoimmunology beautifully. The next person was taking us through the various psychiatric thing, like how the things changes. And now we have the most important thing being Mind Body Medicine Conference. We have Dr. Kanti Reddy who will be talking to us on stress busters and mindful eating and behavioral therapy. I think that's a way to end the program with a positivity. So Mrs. Kanti, a clinical psychologist, and is in charge of Optimal Wellbeing Clinic. I love your clinic name in itself. Everywhere we see holistic well-being. Now, when you say optimal well-being, I think the name is amazing. She has completed her clinical psychology from Bangalore and with an MPhil clinical psychology from Kasturiba Medical College again from Manipal. Uh, sorry. She's also been teaching at Manipal, and she's now working with Asha Hospital, an Institute of Medical Psychology, Counseling and Psychotherapy for the last 20 years, and currently heading the Optimal Wellbeing Clinic, where her work predominantly involves conducting workshops, helping the clients useful mindful-based technique and cognitive behavioral therapy approaches for stress management, internet addiction. I'm sure there'll be a lot of things. Madam will be working even on the digital detox. All of us think of sleep management, mindful eating. I think overall, I think she's going to bring the best out of every individual through her optimal well-being clinic. Ma'am, over to you to take us through how you handle obesity through various mind-body techniques.
Hello, everybody. I'm Kanti, clinical psychologist in charge of Optimal Wellbeing Clinic, Hyderabad. I would like to take this opportunity to thank Dr. Vaishali to give me a chance to participate in this virtual conference. My topic today is management of obesity, psychological interventions. As we all are familiar, obesity is a complex combination of genetic, biological, psychological, socio-cultural, and environmental factors. Today, I will be emphasizing more on the psychological, socio-cultural, and environmental factors. Psychological factors like stress, negative emotions, personality, attitudes, negative beliefs can lead to eating issues. So it becomes highly important to manage these factors effectively. Moving on to stress management. What is stress? Stress is the body's response to change. It is a necessary part of our lives, but prolonged stress can have negative effects on our body and mind. So chronic stress can impact our physical and mental well-being. The stress response is primarily determined by our perception of an event, transition, or problem or difficulty coming from the environment. But still, the perception of stress varies from individual to individual. In this context, I would like to read aloud an anecdote. A teacher walking with her students points to a very large boulder and says, "Students, do you see that boulder?" The students respond, "Yes, teacher, we see the boulder." The teacher asks, "And is the boulder heavy?" The students respond, "Oh, yes, very heavy." And the teacher replies, "Not if you don't pick it up." So what it implies is the perception of stress varies from individual to individual because we are constantly pushing and pulling and trying to move the boulders of our lives into the places we think they should be. This constant reactivity, judgments, and resistance in the present moment is what creates a great deal of suffering or stress in simple terms. Management of stress. So finding a balance in our lives and managing our stress can be a challenge. So what do we do about it? An important first step is to recognize the degree to which we are affected by stress in our day-to-day lives. Then comes identifying the sources of stress, which can be varying. It can come from your social relationships where you have conflicts, or it can come from the environmental with noise and pollution, or it can come from within your body with hormonal changes, premenstrual symptoms, etc. And then after identifying the sources of stress, we move towards effective strategies or adaptive coping skills to deal with stress. Before moving on to the adaptive coping skills, I would like to enlist few of the maladaptive coping skills or unhealthy coping skills that regularly few of my clients who struggle with eating issues face. They use mostly worrying and ruminating because they have excess of uncontrollable negative automatic thoughts. Then they involve in stress eating or emotional eating, lying down passively most of the time with very less physical activity. Moving on to the adaptive coping skills or healthy coping strategies, which leads to balanced lifestyle and better quality of life. The first one I would like to mention is problem solving skills. So in this, the steps involved are define and identify the current problem, generate possible solutions, try the best solution. If it doesn't work out, identify the difficulties, do not give up, have trial and error. If the first solution doesn't work out, have alternative solutions. So personalizing these problem solving skills to a client with eating issues, maybe they have day to day, they have difficulties in situations like going to a restaurant or social situations of dining outside with their peer group. So that's how this problem solving skills helps them to deal with the sort of problems. Assertive communication. So, what is assertive behavior? Is standing up for your own or others' rights in a calm and positive way without being aggressive or hurting others. So, this is something that is lacking in many of my clients with eating issues or poor body image, because what I've seen is many of them are passive submissive personalities where they're not able to express their feelings, their opinions, their choices. They're not able to say no to food in social situations, and they are easily bullied. So I encourage them and teach them to have more and more assertive communication style, which is a favorable communication style, which leads to better quality of social relationships, thus reducing their stress levels coming from social stressors. Then comes practical goal setting. Many of my clients with eating behaviors or who want to follow any positive behaviors tend to have impractical goal setting. Like, for example, they say they want to lose 10 kilos in 1 week. So naturally, I discourage that. In fact, I involve them in this interesting acronym, SMART, where I tell them that their goals should be specific, measurable, attainable with the resources under their control. It should be practical or realistic, and they should know when exactly they want to accomplish it. Effective time management is a very important tool as a stress buster. That is where we teach the clients to do things in priority order, to reduce their tasks into smaller tasks, work one thing at a time, take baby steps, check their progress often. Diet and exercise. Mind you, I'm not talking about dieting, but it is balanced meal plan and feasible exercise that we encourage as a stress buster. Relaxation techniques, these are few of the things that I have enlisted. We teach them as self-control techniques so that they can apply them regularly in their regular stressful situations in their real life. Distraction techniques, or another name that I would give, is pleasurable activities or hobbies. That reduces their worrying or ruminating and also decreases their stress levels. Maintaining a journal or diary. I encourage them to jot down to-do list, what to do tomorrow or what to do month end to reduce their clutter and stress levels. It also helps them in self-monitoring of their physical activities, sleep patterns, or eating behaviors so that they get an objective feedback. I also encourage them to regularly write down their positive affirmations, improving their positive behaviors, just like these. Then use of family and social support. This is highly important, wherein I include the family in my initial few consultations along with the client, because even the family has certain preconceived notions and myths and misconceptions regarding weight issues, regarding the client and eating journey. Coming to mindfulness, the second aspect of my psychological interventions, you all must be very familiar with mindfulness. Just to let you know more about it, mindfulness has its roots in Buddhism. So I would like to start with an interesting quote. Do not dwell in the past, do not dream of the future. Concentrate the mind on the present moment. So mindfulness means being completely aware of all that is within ourselves and around us from moment to moment without preconceived notions, using an open attitude. Mindfulness in everyday life. It can be woven into our everyday lives and actions as our attention can be scattered and distracted by so many things. For example, when I'm talking to my kid, I can be more mindful, more attentive, paying attention to what exactly they are speaking without being distracted. And even I can practice as simple as mindfulness in driving, eating, or any other activity. This is a great picture to illustrate mindful, and unfortunately, most of us are mindful, FULL, where, as you can see in the picture, the adult is cluttered or distracted with his cell phone or dwelling in the past or worrying about the future, whereas the kid is very much mindful and enjoying every present moment to moment. Now, coming to our core topic, mindful eating. Mindful eating is defined as eating more consciously so that you can eat just enough to be satisfied without eating too much or too little, learning to eat the things you love in a sensible way. It's breaking old mindless eating habit, and it is also a skill that can be acquired through practice and helps you to get to optimal health and weight. So, getting into more details of the features of mindful eating, it is knowing your hunger and fullness cues. It is about becoming aware of exactly when you're hungry and knowing when you are content so that you can stop eating. It is also sensing and savoring food and truly tasting it. It is paying attention to the process of eating, for instance, being aware of how you eat. Are you eating fast? Are you taking big bites? Mindful eating is also understanding your emotional triggers, the feelings that urge you to eat or not to eat. For example, when I overeat, I feel guilty, I feel shameful, I regret a lot. Or what are the feelings that urge me to eat more is boredom, stress, anxiety. So I become more aware and learn how to manage them effectively and not through mindless eating. Having a conscious awareness of your food choices. This is very important because this is the initial part of my eating process. Accepting self and body as they are without high resistance. Minding your environment for any external triggers that make you eat mindlessly. For example, commercials about food or any junk food present in your kitchen, these can lead to mindless eating. What is mindless eating? It's exactly opposite of mindful eating, and all of us fall into mindless eaters. So it's not about being a perfect mindful eater or I'm a mindless eater. It's a range or a continuum. So I can be an occasional mindless eater, frequent mindless eater, or very frequent mindless eater. So mindless eating is triggered by emotional rather than physical hunger. This is what I teach my clients to make a distinction between. Emotional eating is sudden desire or sudden craving which comes all of a sudden and we tend to eat mindlessly. But physical hunger, we need to be tuned to our body, wherein we can see we can make out the rumbling in our stomach. There is a big gap between our previous meal and we are feeling faint or weak and we are feeling hungry. So that is physical hunger. Mindless eating is also multitasking while eating, like talking to someone, watching TV while eating, which decreases the focus on eating process. It is skipping breakfast or other meals. It is also ignoring hunger and body cues, continuing to eat despite being full, eating everything on your plate regardless of your portion size, following the motto, live to eat rather than eat to live, believing that you have little or no control, allowing the shoulds and shouldn'ts to dominate food consumption, like I should not eat carbohydrates. So now coming to an important aspect of our treatment is cognitive restructuring. This is very essential for me to become a successful mindful eater. So what I've seen many of my clients with eating issues or poor body image tend to have numerous amounts of frequent uncontrollable negative thoughts which needs to be challenged and modified. So we help the clients to identify these thinking patterns and challenge them. For example, people who struggle with eating issues have distorted thinking patterns. We need to identify these thoughts and modify them. Extreme thinking is one of them, wherein people who practice extreme thinking don't allow any middle ground or gray area. They don't have any range or continuum. For example, I'm either perfect or I'm a failure, I'm beautiful or I'm ugly. Secondly, worst case scenario. In this thinking style, you catastrophize the potential outcome of a situation. For example, if I eat this cookie, I'll gain 10 kilos and no one will ever want to go out with me again. So they exaggerate the consequences. Overgeneralizing is nothing but overstating the facts and making sweeping statements like being fat means you must be lazy. Magnifying and minimizing. This consists of comparing your body type to others and magnifying others' positive attributes or bodily features at the same time, minimizing your own personal positive attributes. Random theories having faulty assumptions. Example, if I exercise, I can get rid of my calories and continue to eat mindlessly. So we help them to clear their myths and misconceptions by approaching an expert. Excess fear of negative evaluation. Many of my clients with poor body image disturbance or poor eating patterns tend to have low self-confidence, and they have social anxiety, and they constantly have fear of getting scrutinized. Example, everyone is looking at my body and they're laughing at me. So we try to tell them that a glance is just a glance. So summarizing mindful eating, the benefits of mindful eating is it is useful to treat a wide range of eating issues wherein it reconnects you with your body signals. It brings about better management of your emotions and changes the way you think or your attitude towards food. Moving on to my third aspect of the intervention, that is behavior therapy. Behavior therapy or behavior modification. The goals are to help patients to make long-term changes in their eating behavior by using certain techniques, like modifying and monitoring their food intake, modifying their physical activity through self-monitoring, which is done through diaries, or even smartphone has these apps which helps you to get an objective feedback about your eating, sleeping, or your physical activity. Use of stimulus control, that is controlling the cues and the stimuli in the environment that trigger eating or overeating. For example, post-its which are reminders of your exercise or presence of any junk food in the kitchen, which can be triggers that can be modified. Now coming to the practical tips to follow in your daily life. Use your senses. Become aware of your senses like your touch, texture of food while eating, or the smell and the visual cues. Mindfully serve your food. Become aware of your portion size. Chew, chew, chew. Take one bite at a time. Give pauses. Pace yourself to slow down the process of eating. Set the ambience to reduce multitasking and distractions so as to focus more on your eating behavior. Avoid being too hungry before your food ordering or supermarket shopping. Because if I'm too hungry, I tend to impulsively overorder, or I tend to impulsively buy junk food, especially in supermarket. Break the habit of cleaning your plate even if it is one bite. Use compassionate language with yourself and others. Try and not to be judgment about yourself or others. Let go of dieting, be realistic. So that means no more starvation, no more depriving of food categories. Letting go of your former or future body, accept yourself as you are at the present moment and be proud of your body. Identify your natural body shape through coming through your genes. Do not use mirror to judge yourself. Why am I saying this is I've seen many of us tend to use mirror or pictures to judge ourselves. So stop using that. Instead, use the mirror to become a smart and mindful dresser or to adjust yourselves. Have a mindful response to cravings. Approach cravings by having a plan. That is, you smartly approach it by not reacting impulsively. Instead, have a better control over cravings. Maintain a moderate, realistic, and flexible approach to exercise and include more movement in your daily routine. What I've seen is many of them tend to have impractical goal setting for exercise, and that does not seem to be consistent in your long run. So that's why it is very important that I'm very practical about my exercise plan. Similarly, I also advise them to include more physical movement, because I've seen many clients, they do this exercise for 1 hour and rest of the day they follow a couch potato lifestyle wherein they are ordering others to get remote, switch off the lights or fetch water. So please include more physical movement in your daily routine. Change your regular mindless eating traps like your social circles, holidays, or restaurants that you are already aware of, so that you change the antecedents for reducing your undesirable behaviors. Socialize without food. I know it's difficult, but try. Do not skip meals. Eat 3 times a day following a balanced meal plan. Steer clear of your binge foods. Keep healthy foods available and accessible. It's always helpful to have a snack handy. Do not use food to cope with fatigue, stress, or any other negative emotion. So, why did I mention fatigue here? Is I've seen many of these working people, once they come back, they're so tired and they confuse tiredness with hunger and they tend to overeat. So, please start identifying fatigue. Practice gratitude for the food you eat. This is a good habit because it slows down the process of eating and it improves the positive approach towards food. If you're planning to eat outside, notice how hungry are you. If you're very hungry, have a snack, plan better. By the time you meet your friends or go to a restaurant, it becomes too late and you might tend to become very hungry, and that's where the clarity of thinking decreases and you might become a mindless eater. So order wisely when you're in a restaurant, drink water. If you're planning to take alcohol, drink mindfully, avoid buffets, that they're disasters. So another quote that I find it very interesting is make room, not find room. So if you're going to a restaurant, you're aware that you want to have your favorite dessert there, have a plan. Make room for it with minimal appetite and main course so that you make room for the dessert and do not find room for it wherein you are overeating. Choose good dining companions in the sense who are wise, who don't overeat or overorder. Share an appetizer or dessert. Minimize business lunches and dinners because it's become very common these days. Coming to my last slide, that is relapse prevention. It's equally important as much as the treatment because I prepare my patients that fall down 7 times, get up 8. That means mindful eating is a continual journey that requires an enormous amount of persistence, practice, and time. And I tell the patients to expect the occasional out of the blue, unintentional, mindless eating so that they are not discouraged. And when they get discouraged, I ask them to think progress, not perfection. It's equally important that they attend the booster sessions. And in case they find themselves into the trap of mindless eating, it's okay. Forgive themselves and get back to the mode of mindful eating. Thank you.
I think it was nice. I like the last statement, the progress. That was very, very good. Like it's not perfection, but just progress.